Bismillahirrahmanirrahim. Assalamualaikum and hi. My name is Putri AMEERA NADIA binti Abdul GHANI and I'm a Year 1 medical student. For this SSM assignment, I would like to talk about the female reproductive system. Before I start, I would like to show my gratitude towards our supervisor, Professor Dr. Zainal Arifin, who patiently guided us with his knowledge throughout the whole journey of completing this assignment. I would also like to thank my fellow friends and family for their unwavering support. So without further ado, let's start this presentation. Firstly, I would like to explain briefly about the female reproductive system before we go into more details. The female reproductive system is made up of internal and external reproductive organs which facilitate menstruation and procreation. This system is responsible for producing gametes, termed eggs or ova, regulating sex hormones, and maintaining fertilized eggs as they develop mature fetuses ready for delivery. Next, we will be talking about the anatomy of the female reproductive system, focusing on the internal organs. The internal organs are the vagina, the cervix, the uterus, the fallopian tubes, and the ovaries. Firstly, the vagina is a distensible muscular tube which connects the uterus and the cervix to the external vaginal orifice. The vagina is involved in sexual intercourse, childbirth, and menstruation. Secondly, the cervix is the lower part of the uterus just superior to the vagina. At each end is a cervical os, a narrow opening into the uterus and vagina either side. It facilitates the passage for sperm while maintaining a sterile environment in the upper female reproductive system. Thirdly, the uterus, which is in the pelvis between urinary bladder and the rectum and commonly referred to as the womb. There are several sections of the uterus. One of them is the fundus, where we can see it is in the uppermost and widest part of the uterus that connects to the fallopian tube. Fourthly, the fallopian tubes connect the ovaries to the uterus that functions to transport the ovum towards the uterus. Their length is split into sections, which are the fimbriae, the infundibulum, the ampulla, and the isthmus. And lastly, the ovaries are the female gonads and so are the site for gametogenosis. They sit laterally to the uterus and closely adjacent to the fimbriae of the fallopian tube. Next, we'll be talking about the physiology of the female reproductive system, which is about the menstrual cycle. Before that, I would like to highlight about the key hormones involved. Firstly, it is the follicle-stimulating hormone or FSH, which stimulates the follicle growth in the ovaries. And then it is luteinizing hormone or LH, which triggers the ovulation and the corpus luteum formation. And then we have estrogen, which regulates the growth of the uterine lining for potential pregnancy, and progesterone, which maintains the uterine lining for potential pregnancy. As we already know the key hormones, I will proceed to the physiology. There are 4 phases in the menstrual cycle, which are the menstrual phase, the follicular phase, ovulation, and the luteal phase. Firstly, the menstrual phase from day 1 to 5 is when the menstruation begins. During this stage, the thickened uterine lining starts to shed, and mind you, this is when the pregnancy has not yet occurred. The hormone levels are low for both estrogen and progesterone. The uterine line broken down will be expelled as menstrual blood. The second phase is the follicular phase from day 1 to 13. This phase overlaps with the menstrual phase. Hypothalamus of the brain releases gonadotropin releasing hormone or GnRH that's stimulating pituitary gland to release follicle stimulating hormone or FSH. FSH is then stimulates several ovarian follicles to mature, where each containing an egg. As follicles mature, they secrete estrogen to rebuild and thicken the uterine lining for preparation of fertilized embryo implantation. Moving on into the third phase, which is the ovulation, it happens during the 14th day. During this stage, estrogen level peaks, which triggers a surge in LH from pituitary. LH surge causes the dominant follicle to rupture and release a mature egg from the ovary into the fallopian tube. Thus, the egg is now available for fertilization. The last phase, which is the luteal phase, occurs from day 15 to 28. After the ovulation, the ruptured follicle transforms into corpus luteum, which secretes its progesterone. If fertilization doesn't occur, the corpus luteum will degenerate, leading to a drop in progesterone and estrogen. This also triggers the breaking down of the uterine lining, resulting in menstruation and cycle repeats again. Now, I would like to talk about the diseases related to the female reproductive system and the treatments. Firstly, it is the cervical cancer. The risk factors include exposure to the human papillomavirus HPV, smoking, and immune system dysfunction. The diagnosis that can be done is a pap smear or visualization of a lesion on cervix. It's most often a squamous cell carcinoma caused by human papillomavirus HPV infection. It starts as a cervical intraepithelial neoplasia and develops very slowly. Many cases of cervical cancer can now be prevented by injecting HPV vaccine or caught early on by going through screening for precancerous lesions with pap smear test. As for precancerous lesions, it can be removed by cryosurgery or conization, and as for cervical cancer, it can be treated through surgery. This occurs most often in women who are obese or during pregnancy. And so, this is how the lesions look like on the cervix and the appearance of the cervix from normal to being infected. The second disease is the ovarian cysts, which are sacs in an ovary or on its surface filled with fluid, which are non-cancerous. Large ovarian cysts somehow may cause pelvic pain that may come and go, fullness, pressure or heaviness in the abdomen, and bloating. The risk factors are hormonal problems and endometriosis. The complications could be ovarian torsion and cyst rupture. As we have discussed the diseases, surely there are types of treatments that can be done. Firstly, through radiation therapy. It is a treatment that uses high-energy X-rays or other type of radiation to kill cancer cells or prevent them from growing. There are two types of radiation therapy. One is brachytherapy, which places radioactive material directly inside, and the other is external beam radiation therapy or EBRT, which is the opposite. Next treatment is through surgery. There are also two types of surgery. The first one is ovarectomy, which means the removal of the ovaries. The second one is the hysterectomy, which means the removal of the uterus. For the last part in this presentation, I'll be talking about a well-known specialist related to the female reproductive system in Malaysia, which is Professor Dr. Wu Yinling. She is known as a consultant gynecological oncologist at University Malaya Medical Center, UMMC. Currently, she is a professor at the Faculty of Medicine in University Malaya in Obstetrics and Gynecology Department. Besides teaching, she also has contributed over 100 journals and articles mainly about the diseases related to obstetrics and gynecology. And recently, in 2023, she has won the 2023 Rachel Pearline Award for her contribution to cancer research and practice in low and middle-income countries, which is something that a Malaysian should be proud of. Thanks to her commitments in contributing to women's healthcare, she has inspired many people, including me. I look up to her a lot and hope that in the future I can also follow in her steps. To conclude, the female reproductive system, including the ovaries, the fallopian tubes, the uterus, the cervix, and the vagina, regulate ovulation, fertilization, and pregnancy preparation. The key hormones involved are progesterone and estrogen, FSH and LH, to ensure fertility. To protect uterine health and fertility, it's important to prevent infections and diseases through safe sex, regular checkups, and a healthy lifestyle to improve women's healthcare. That's all from me. Thank you.